Well, up first on the show, let's focus on India's numbers. And India has reported 75,760 cases of COVID in the last 24 hours, marking the biggest daily rise in the country. The fresh cases have pushed the country's COVID tally to over 33.1 lakh cases. 1,023 deaths have been reported in the last 24 hours, and this takes the total number of deaths past 60,000 to 60,472. Now, India's on the top in daily cases in the world since the last 23 days. That means every day we've been reporting the maximum number of daily cases of coronavirus. India also reported the highest number of deaths consecutive for 2 days consecutively. And globally, India is the third worst hit nation from the pandemic, though India could overtake Brazil sometime in the next 2 weeks if the cases continue to grow at this very same pace. So let's just take a look at the rate of increase in COVID cases, and the rate of increase currently is 2.3% right now. A week ago, it was 2.5%. 4 weeks ago, it was 3.4%. So that percentage rate of increase is coming down. And if we take a look at another very important number, which is the positivity rate, well, today it's gone up, in fact, 8.1%. That's up from last week when it was 7.6%. The positivity rate comes down the more you test. 4 weeks ago, in fact, it was over 10% at 11.3%. So very, very worrying figures. What do they mean? To talk more about this, we're joined by Dr. P. Raghuram, President, Association of Surgeons of India. He joins us from Hyderabad. Also, Dr. Rajesh Parekh, Director, Medical Research, Jaslok Hospital from Mumbai. Also the co-author of the book, Coronavirus, What You Need to Know About the Global Pandemic, which, of course, Doctor, you wrote so long ago, and now there's so much more that we know about this pandemic. But first and foremost, this increase in the number of cases. Now, it's obvious that as we test more and more, we are going to see more numbers of COVID cases coming forward. What are the numbers we need to watch out for? Is it the positivity rate, the number of deaths? Also, a watch on our hospitals and hospital beds, and how many are occupied?
Good afternoon, Gargi.
Gargi, first of all, even though our testing rates are relatively high compared to what they were earlier, even at 27,000 per million, we are far short of what we should be testing. To give you a comparison, the United States, which is #1 in the number of COVID cases, is testing 9 times as much as we are. And even Brazil is testing 2.5 times as much as we are.
Right.
So as our testing gets ramped up, of course, the number of cases will go up. And in fact, in the book that you alluded to, we had written as far back as February that India will probably have the highest number of non-confirmed cases in the world. And as testing ramps up, it will also probably have the highest number of cases in the world. So we already today, I'm reasonably certain, have the highest number of non-confirmed cases. And, a case becomes confirmed only when there is a test that is positive. Of tests, if I may add, there are false positives and false negatives. And while both the PCR and the rapid antigen testing have relatively few false positives, they both have high negatives. And a large component of these tests that we are doing are rapid antigen tests. I understand that in the circumstances, we do not have too many options, but it's a sobering thought for us to realize that the rapid antigen tests that we are deploying has a lot of false negatives,
right,
almost as high as 35%. So we're actually missing out on a lot of cases, and the real cases are far in excess of what we believe they are.
All right. So you believe the cases are in excess. Dr. Raghuram, do come in here. What is your take on, what we're seeing right now with the over 75,000 cases being reported in the last 24 hours? We'll come back to Dr. Raghuram in just a minute. Seem to have lost the line there with him. But coming back to you, Dr. Parekh, so going forward, it also seems that that people are getting tired of the restrictions. And on one hand, we're frightened when we look at the numbers. But on the other hand, there's a lot of fatigue setting in as far as, the restrictions that people have undergone. So people are becoming more careless now.
I agree entirely with you, Gargi, and that's my biggest concern, that, a false sense of security is setting in, and that people, as you mentioned, are fatigued of all these restrictions. But the key takeaway, if there is to be one from our discussion, is people have to be even more careful now than they have been before. The analogy I try to bring up with whoever I talk to is this is like mountain climbing. You might get 99 steps right. You need to slip only once for it to be a disaster.
All right, there's also a sense, I feel, among a lot of young people who again are reverting to that, what those phrases we heard earlier, oh, it's just like a flu, nothing really happens, you're asymptomatic. So again, a lot of people now questioning, they're talking about how during the lockdown, there were just a few thousand, few hundred cases and, we were all frightened and cowering in our houses. But now there are lakhs of cases and we're all walking around and there's this sense that, it's not as bad as it was made out to be.
But therein lies the irony. When the cases were fewer, we were far more concerned. And today, when there has been a monumental increase in the number of cases, as one had expected, paradoxically, people seem to be more relaxed on it. But Gargi, talking about young people, I do have a quick question for you, if I may.
Sure.
Why are you more fond of my son than of me? There I stumped you. Okay.
I didn't quite understand, but yes, go ahead, doctor.
You don't get quiet. You questioned my son, Swapnil. He's also been on your show a few times.
Yes, of course he has.
Everybody in the family says you're far more fond of him than of me. So that was my question to you about your bias towards young people.
Well, no, not at all. But, do tell us about, again, coming back to the fact that there's so many asymptomatic people also. That's a big worry. We have Dr. Raghuram also back with us. Dr. Raghuram, if you could also come in here. We were discussing, the numbers that are coming out now. Over 75,000 cases of COVID have been reported in the last 24 hours. And it's a frightening number. And the thought that in a few weeks we could even overtake Brazil and become the second most affected country. And we were just discussing how, but at the same time, the unlock measures are underway. Come September, we're going to have more unlock measures there. So it's difficult to really balance the two. On one hand, for the public to tell them this is still very, very serious, the coronavirus pandemic. But at the same time, we're hearing of all these measures, how things are opening up. So people are becoming more and more careless and fatigued by the restrictions.
Indeed. Good afternoon. Thank you for having me on your show. Yes, it is frightening if you look at the numbers per se, but I think, as I have mentioned before as well on your shows, the total number of cases, the absolute number of cases are increasing. The absolute number of deaths are also increasing. But actually, if you look at the number of deaths per million, India ranks at somewhere around 28 or 30 deaths per million. When you compare it to other Western countries, it's about 600 to 700. So it's 20 times lower. That is the first thing. And despite the number of cases, the number of testing, the number of are doing in India is increasing. And over the past 1 week, we have been doing more than 9 lakh tests per day. And despite this, our, the case positivity rate is under 10%. It's around 8% or so. And equally, the case fatality rate is under 2%. And the number of people who are recovering are over 76%. So these are all good figures. Yes, the number of cases are increasing, and so are the number of deaths also increasing, but it has to be taken in the right perspective. And this is also expected with the increasing number of tests that we are doing in our country.
Right, Dr. Ram, also, we're not seeing those frightening images that we saw earlier. Of course, no one wants to go back there, but perhaps that's one of the reasons why people are also taking it, more lightly now. As I was discussing, with Dr. Parekh, that earlier, how a lot of people are talking about how earlier there were fewer cases, just hundreds and thousands, and we were all under this strict lockdown and, very frightened about coronavirus. But now we have lakhs of cases, and even now we're going into, more stages of unlock. So people somehow are not taking it as seriously. Our hospitals are, of course, doing much, much better. And we're not seeing those visuals of, hospitals being very pressurized, doctors, nurses being overworked like we were seeing earlier. And perhaps that's one of the reasons that people are not taking it as seriously as they should.
Yes, very true. And actually, the number of cases are now moving from the metros to the smaller towns and villages.
That's right.
And as you can see, more than 54% of our case positivity rate is actually in the rural parts of our country, whether it is Andhra Pradesh, Telangana, or many other states. And with the lifting of the lockdown in phases, there is a lot of irresponsibility as well that we are seeing on the street. People are not wearing their masks properly. Social distancing norms are not being followed. And if we let our guard down at this crucial moment when things are getting better, then I think again the numbers will increase significantly, and therefore how responsibly we as a nation behave will determine largely the effect of the pandemic in our country, and the citizenry must take this seriously.
All right. Well, thank you so much, doctors, for joining us on the show and, emphasizing the need for us to continue to take this very, very seriously. Look at the numbers that we're seeing right now. And of course, here at NDTV, we'll continue our focus on this issue. Thank you so much for joining us on the show today.
Thank you.